Definitely more complex care, more disease process management needs, more mental health concerns and challenges within the senior living setting. And then you compound that on top of the challenge of workforce issues, staff turnover, hiring the people with the right credentials, and then the worries from ownership about occupancy. I think those three areas are really the biggest challenges in the changes we've seen, where we're more worried about occupancy because that apparently for many operators is driving the bottom line. And we're concerned about the challenges of acuity that are confounded by that concern of workforce turnover, best credentialed employees, and just preparing the environment and the workforce to be able to meet these needs that are more, perhaps even more than we bargained for at this point in the evolution of senior housing. There are a lot of things our software does to support the nurse particularly. Our software supports the entire operations from lead generation, prospect management, admission, electronic health record, all the way through to creating the invoice that goes out at the end of the month. Some of the ways that we support our clients in that are through the robust data reporting, where there are data reports that can inform you as to actual service demand, which is really a reflection of true acuity in your building. And now that kind of report can tell me these are the number of hours of staff I need on duty on each shift to meet the real needs of the people that have come to live in our community that we are caring for, as one example. Clinical needs becoming more complicated. Our software platform is very deep and robust and capable of managing very high acuity care programming and clinical practices if that is something that's needed by the provider. We are now piloting a very collaborative mental behavioral health program in managing mental behavioral health in senior living. And we created the assessment in the software, the aftercare program in the software. We have a care management feature that helps keep the collaborative care team serving the individual in connection with each other, as well as in connection with the individual and their natural supports. And so the technology in supporting that whole model, what we're seeing is a quicker referral to mental health services. So instead of 90 plus days, we've shortened it down to 2 weeks. We're seeing excellent results from the treatment episodes, and the clinical team, even down to the frontline caregivers, becoming a part of that aftercare program and helping to support the progress made during that treatment episode. As long as we know what's going on with our client, we can help build a program and a model where the technology can help support their efforts. As salesy as it sounds, when we say we really become your technology partner, we really do. There are a lot of us on the Eldermark team that come from the senior living profession, so we have deep experience in operations, in CRM management, in clinical practices. And so in addition to what we offer in technology solutions as far as what are the things that the technology can do, we have team members that can also work with the client in helping put together the right workflow, the right configuration of the software to match policies and procedures, to give advisement on how to set up the database so it best serves your goals.